from these four paradigm shifts, the final paradigm shift is something that is a pivot on which Dr. Sarita and I are standing today, and for which we owe this completely to this gentleman at the top, Professor Franco Agosta. So when I was in the UK in the sort of late 90s, came out the paper in NEJM where it was called the partially mismatched family donor transplantation can improve the outcome in high-risk leukemia. I still remember it, by heart, the name of that paper, because these are the events that changed my professional life and career. And it was so fascinating again, it will be a different discussion by itself, but it was so fascinating. I touched base with this gentleman. And he invited me to 2 consecutive haploidentical workshops, which took place in 1999 and 2000, led by the Perugia group, who pioneered haploidentical transplantation as successful mode of transplant. So from 1960s, where we believed that, you have to have a HLA match to have a successful transplantation. And you have to have myeloablation to have successful engraftment. We have now moved in the 90s to a situation where we can achieve engraftment without myeloablation and where we could do transplantation without having a full HLA match. So this is the journey which I had and which is up to the 90s that I'll stop over here. We will take it forward through the various sessions, and we are happy to sort of take requests as would be made by peer students as to what they want to be talked about, what they want to discuss, because what we want, Dr. Sarita and myself, that we want people to discuss. What I find a very worrying trend across the country is that people pass their DM in hematology or oncology, and they become transplanters after that in individual centers, private hospitals. 30 years later, I can promise, I know very little about this field. I'm still struggling. And I'm just narrating my journey. The journey has more failures than success. And I'm here to share the failures more than the successes. And, I think people learn from their failures. So the next generation will have to learn from our failures. Donald Thomas learned from failures of George Mathey, and Frederick Applebaum learned from failures of Donald Thomas. And so it went. I haven't named another great person who I thought I would name on this session on haploidentical transplantation, but this wouldn't be complete without it. That a lot of you are talking about PTCY, and you think that it's something that's so easy to do. But George Santos was the one who, as long back as in the late 60s and early 70s, had floated this concept. The transplanters then were not brave enough to take it forward, but it was Richard Jones and his team, his students from Johns Hopkins, who later, through again a series of animal experiments, established the veracity of the concept that post-transplantation cyclophosphamide can be used. So this discipline stands on great contributions from some, phenomenal people who have dedicated their life for this discipline. And the purpose of talking today was to give a feeling about, the journey. The journey for me was from 1990, but people who have been there before have seen what has happened before and how diligently, how honestly these people have worked to make it a success today. So it hurts me when I see today that in the name of CAR T cell transplantation, people say that cellular therapy has emerged. My dear friends, cellular therapy emerged as long back as in 1960 because the first form of cellular therapy is allogenic hematopoietic transplantation. And the pioneers of this are not today's CAR T cell makers who are sitting in a lab and engineering T cells. Sorry, it started 50 years back, and it's still the most effective and strongest form of immunotherapy known in human history. So I would salute those great men, including my teacher, Tony O'Kill, who is no longer there, and many others who have contributed in this journey. And I hope and expect that some of this would help others to shape their careers as well, beyond just doing transplant, trying to love the discipline, trying to understand the discipline, trying to improve the discipline, and most importantly, trying to innovate in a scientific manner. Thank you, everyone, for your patient listening.